Thank you, Madam Chair. I appreciate it. Good morning. Good morning, Commissioner.
Morning.
Just a few questions, and the good Representative Brown did touch on it lightly. The reducing of funds to local health districts and the consolidation. You have, obviously, in the line item here, $920 million of cuts. It has been reported out that there would be charges to the towns to go to the regional health districts. Where does that revenue go to?
So in the bill that was raised today, there is no, it shouldn't be any impact in our budget with regard to local health, the consolidation part. So it's interesting, things got misrepresented. Initially, we have suggested a allocation of municipal budgets for the districts. But in what is proposed today, and after negotiations and listening to elected officials, health directors, and the community, we did around 4 town halls around the state to listen to people's concern with regard to this. So in the proposal that we put forward, and that you probably will have the opportunity to read later, there is no amount attached to the formation of the districts. They will determine themselves, as they do now, what is the right amount of money they can invest in tackling the health issues at the local level.
So is this 7170, are we
Yes.
looking to eliminate the regionalization of the health districts?
What we are looking to do is consolidate and integrate the health departments. So the state has about 74 health departments, and we have actually 3 systems running at the same time. We have the municipal health departments run differently, then we have the health districts that run differently, and then we have full-time health departments, we have part-time health departments, and then we have the 2 independent nations. And we have about 172,000 people in Connecticut that do not receive full-time public health services. So that's the system.
I understand that, and the consolidation, I think you'd come back to the working group with this cut, there is going to be a cost to the municipalities, is that correct?
There could be a cost and also a decrease for some. So what you have in Connecticut, we have disparities, how money is spent in public health. You have districts that are spending $17 per person, and you have other districts that are spending $4 per person. So with regard to the disparities, I think that's going to level itself.
Well, and I appreciate that, and we can come back to the working
Yeah.
group with it, but when you have a health district, like in the northwest corner in the city of Torrington, we cover over 1,000 square miles, and the health district is running very well. If something's not broke, why do we have to disrupt it and then cost the municipalities money to have to chip in? So, and I'm looking to see, and I will dig deeper as my good representative says, we always have to dig deeper to find out where those revenue monies go to, and if they don't go into your department, that'll be a concern. My next question for you, and then I'll relieve the floor, is really need to look at the reducing of the school-based health centers, because by reducing this, we are a distressed community, one of the ones that Winchester, which I represent also, one of the 4 towns. This is where the kids get their care, and we really need to take a look before we do decreases there and putting ads in for other things. I know we have the ability to change it, but I think we're going to cost ourselves more money. So I thank you for being here today. I think there's going to be a longer discussion. I'm looking forward to go over and listen to 7110 and see how that works out. But the communities, I think there was a lot of misinformation, and we're trying to filter out what the costs are. City of Torrington just emailed me, they're about 20% cut with the proposal in the budget right now. But we need to look at the ones that are working properly and the ones that are working fine and not harm these communities, because that's what this budget does all the way through. But I appreciate your time, and thank you, Madam Chair.